Hi, my name is Karan Menon, and I'm a first-year medical student at the Chicago Medical School at Rosalind Franklin University.
My name is Jacob. I'm a second semester ABSN student at the University of New England.
My name is Jonathan, and I'm a second semester social work student at UNE Portland.
And all of us were part of an interprofessional team that did a simulation where we did telehealth visits to treat a patient with long COVID. So a little bit of background on what long COVID is. It's really an umbrella term that describes a wide variety of symptoms that continue to persist for a patient after an initial COVID diagnosis. These symptoms can persist for weeks to months after the patient has been diagnosed with COVID, and they can encompass a wide variety of symptoms such as shortness of breath, headache, dizziness, diarrhea, depression, and even more. What makes these difficult to diagnose and treat is that it's still not quite well understood why these symptoms continue to persist. And oftentimes lab work and imaging can appear normal when a patient comes in for a visit. And all these factors make this just a very difficult problem to deal with. And that brings us to our patient, Amanda. So Amanda Barry Mansell is a 39-year-old female who lives with her wife, Mo, and their children out in rural Maine. And in November of 2021, Amanda was unfortunately diagnosed with COVID and had to be hospitalized. And her respiratory status worsened enough that during her stay in the hospital, she had to be intubated and placed on a ventilator for 6 days. Fortunately, she did recover enough to be extubated and was eventually discharged after a total of 11 days stay in the hospital. But even after her discharge, Amanda continued to complain of symptoms that persisted, most notably headache, shortness of breath, and a persistent cough. These symptoms persisted enough that Amanda unfortunately had to take some time off of work. And this did end up taking a toll on her mental health as she felt as though she was not able to contribute to her family, which ended up resulting in the consultation of our interprofessional team to jump in.
Our interprofessional experience began with a large group orientation that encompassed team building exercises and information on telehealth and motivational interviewing. We then had 2 telehealth visits with our patient, occurring a couple of weeks apart. Each visit consisted of 2 20-minute sessions that comprised 1 visit with a debrief in between and afterwards. And our second visit, we got to meet Amanda's partner, Mo, and we had a debrief with live feedback from our patients. As the nursing student on this team, I greeted Amanda and introduced her to our interprofessional team. During this time, I demonstrated empathy and used active listening skills to develop trust and rapport. Using these techniques, I got more insight into her symptoms and medical history. During our second session, I welcomed Mo and discussed the accessibility and effectiveness of our team's previous recommendations. As our social worker student utilized motivational interviewing techniques to develop rapport and learn about what mattered most to Amanda and Mo. Using these methods, he was able to discuss the importance and the impact of Amanda's condition on her relationships, occupation, and financial status, and provide information about different support programs available. Our dental student discussed the importance of oral health care with Amanda, including regular dental visits. He also inquired about her headaches to see if there was a link between migraines and issues surrounding the oral cavity. Our allopathic and osteopathic medical students took a deeper dive into Amanda's symptoms, performed virtual assessments of major body systems, and discussed the impact long COVID was having on her mental health. They also discussed different pharmacological and non-pharmacological treatment options that we discussed together as a team, the possibility of her coming in person for a clinical visit, an MRI scan, and referrals to specialists, including a counselor.
Working in rural communities provides challenges both for patients and caregivers. It can be difficult to access care providers in sparsely populated and underserved areas. This is where telehealth has such a great potential to bridge that service gap, and without it, a team intervention such as ours would not be possible. While telehealth brings great opportunities, it also brings some new challenges. And you can see those pros and cons listed here on our infographic. Every member of our team brought a valuable contribution to tasks for Amanda and Mo. We learned from one another the different roles that each provider can play in coordinating care for one patient. Additionally, the process of meeting at various times before, during, and after each session with the patient gave us valuable time to discuss our approach and the various ideas that we had to help Amanda and her family. Long COVID proves to be a challenging problem for many people, and it's important that healthcare providers are collaborating to help find effective treatments for those that are suffering like Amanda. This experience has helped prepare us for future interprofessional collaborations. As we enter the workforce, we are better prepared to take initiative and work together across professions to coordinate holistic healthcare treatment in our communities.
Thank you for that nice recording and good description of the case. Are there any questions for the team? If not, I have a couple of questions. What was the most surprising thing about this experience with this particular patient and simulation?
I guess I can start off with that. I'd say for me, the most surprising part was that going into it, we expected that a very large chunk of this would be spent on more of like her physical symptoms and a lot of the medications and different treatments that we would do. But we were fortunate enough to have a social worker, and we saw that some of the most insightful conversations that we had were more about her mental health and how her condition was kind of affecting her family dynamics. As I mentioned in the recording, one of the things that the patient, Amanda, told us was that because she had to take time off of work, there were a lot of feelings that she had that she wasn't contributing enough to the family. And that was something that we spent a considerable amount of time across multiple sessions diving into. That was mostly tackled by our social worker. And I thought that was insightful just because I guess sometimes we kind of overlook the human side of it while tunneling in on the medical side of it. So I thought that was good that we had those conversations.
Those are great insights. Other members of the team, do you have anything to add?
I agree with Karan. It was definitely an interesting experience, and we got to learn a lot. And one of the things that surprised me most as well was the impact that it was having on her personal life, on her work life, and her relationships. And like Karan had mentioned, it kind of, I think, took the whole team kind of by surprise that our focus became more focusing on the impact that long COVID was having on Amanda's relationships and the impact on her children and Mo, her partner. Originally going into it, we were kind of more originally focused on like the medical aspect, but it quickly shifted gears towards her psychosocial health as well.
Excellent. Jonathan, how do you feel that the telehealth angle got involved in all of this? Do you think it was helpful or was it frustrating for you?
Well, Sarah, I think it was a little bit of both. And I think initially it was very difficult to connect with Amanda in the way that I am accustomed to working in person. And a part of it was because of that technological barrier, and then part of it, I think, was just because of her condition with long COVID. I also found it challenging to connect with the team members until we started to get going, and I started to see how other people were working, and then it became a very interesting and a very valuable experience. So I came into the project with, I think, maybe a little bit of a bias or a hesitation towards telehealth, which is why I kind of chose to talk about it in the presentation, because it became really eye-opening to me, particularly as we talked about the case, and our team name became, the rural respecters, reliable rural respecters. And I thought that was fun because, Amanda had a transportation issue, so telehealth was really the best means for her. And for us to be able to come together in this way, it was a very efficient use of our time, and telehealth was really the only way that it ever could have happened.
Excellent presentation, and we'll move on to the next presentation. Okay, the next presentation is also on the same simulation, the long COVID simulation. And this is the 100% oxygen team.
Title is Managing Long COVID Through Telemedicine and Interprofessional Approach. Our objective is to apply motivational interviewing techniques and treatments of a patient with long COVID via telehealth. We have a wide variety of team members from UNE and Ross and Franklin. The case background focuses on long COVID. 1/4 of those with long COVID are left with long COVID, and it overall diminishes the patient's quality of life. And the patient background, so we had Amanda Barry Mantle. She was 39 years old. Her goals are to relieve the migraines and fatigue triggered by her long COVID diagnosis, to improve her current quality of life, and to receive quality care via telehealth due to her lack of transportation. And she prefers neuropathic approaches to her care.
So for the first session of our encounter with the patient, our team went in with two major goals: to obtain a full medical history and to understand the patient's chief concerns. We had some meeting outcomes, which included taking on board patients' concerns of not being able to engage as she used to, not having the strength that she used to have, and experiencing brain fog with some of our questions. The patient also showed signs of lingering loss of smell. So we further evaluated the patient using the SIGS tool just to access for depression, and the patient scored on the lower borders of the scale, which meant that she did not have any concerns with depression. So we went on to advise the patient to take ibuprofen twice a day and to try to use an ice pack to help alleviate the pain.
At our follow-up session with Amanda, our goals were to integrate Amanda's husband, Mo, who would be joining us for the session, to provide potential attainable treatment options for her, and to continue to provide support and validation for both Amanda and Mo. We followed up with how her week had gone to see if anything had changed. Unfortunately, not much had changed. Mo and Amanda both shared that they were feeling pretty frustrated and isolated from their friends and family because of Amanda's long COVID. We discussed further treatment options that we could provide for our patient that followed the naturopathic approach that she wanted, including osteopathic manipulation, home health and physical therapy to help with stretching, and even mindful meditation.
Overall, afterwards, we met with the actors and they felt that we did a good job listening to them. Specifically, Amanda said she felt treated like a human, which was huge.
From a physician assistant perspective, our biggest takeaways were that the goal isn't always fix a patient, but to provide support and validation that what they're feeling is real and that we're really in this for the long haul with them.
From the dental medicine perspective, it was definitely challenging to incorporate dentistry into a very, very medically rooted case, but it was important for me to make sure her and her family had access to care and made sure that they were being checked in on every aspect of their health.
From the social work perspective, it was important to learn how to provide appropriate resources for the patient and their family.
Overall, we respected the patient's beliefs of the naturopathic approach and found limitations of telemedicine, such as communication and interpersonal relationships forming over a screen, slightly challenging, but it was definitely an important skill to learn. And we also learned the importance of interprofessional work, as it is a hard skill, but definitely an important one to incorporate in our health professions.
Okay, thank you so much for that presentation. Are there any questions from anyone in the room for this team? If not, I will always have questions for you. What was it like developing a sort of sense of team over the telehealth with this case? How did that work for you?
I'll start off. So I think it was really interesting to not only have students from UNE, because we may be a little familiar with everyone's curriculum at UNE, maybe just a little, but having also students from Rosalind Franklin who may have a vastly different curriculum than we have. But we were one of the fortunate teams that had just about every profession available to us. We had an MD student, DO students, physical therapy, social work. So we really were able to bounce a lot of ideas off of each other, some feeling like a little more medical side, some allowing us to learn about different like opportunities and outreach programs that we learned a lot from, like our social work student that I didn't know anything about prior to this. So I really learned a lot having the opportunity to work with other professions in this simulation.
Did your team get into any sort of frustrations with each other or conflicts, or was it more like learning how to understand each other's points of view and approaches to treatment, et cetera?
I think we all came in with a very different approach to how we wanted to approach the patient, but I think we were able to kind of like mend those together pretty well overall.
Are there any things that you will take with you on your career about using telemedicine or working in a team? Sort of personal revelations.
For me, I'm the dental student, so it was a little tricky to incorporate dentistry into this case for me.
So I kind of learned that it's still important, no matter what you're dealing with, that to make sure that your patient's dental health is still getting taken care of. And I found it extra important to kind of teach that to my team members, or at least I hope I did.
So there's more than one kind of learning going on here. Yeah. Okay. We have a little bit of time, and oh, Donna, do you have a question?
Yes, thank you. So Donna Hyde, one of the nursing faculty. I think it was Crystal, you had mentioned how you can have that loss of that personal relationship if you're using telehealth. Did anyone feel, and this is either case, that the use of telehealth might have been an easier format for some individuals that might not have been comfortable in a personal setting, that it provided them a different kind of opportunity to have a little safety between the provider and the client?
I think the more opportunities we can provide for our patients and more options, the more opportunities we'll have to treat them. And when they're more comfortable, it'll just make that process easier, I think.
Good insight. Well, thank you all very much. It was an excellent presentation, and we'll now move on to the next. There they are.
Welcome to our
Okay.
presentation on addressing the social needs of rural long COVID patients. This presentation was done by Lily Russell, Skylar Evans, Alina Haugen, Brooklyn Otero, Rochelle Mandola, and Julia Shepard. First, to address the problem with connecting social services and social needs in rural areas, we need to recognize how relevant the rural community is to healthcare providers in our area. Maine and Vermont have the highest proportion of populations living in rural areas at around 61%, while California has the lowest at around 4.9%. This means that accessible care is likely a concern for the majority of Maine residents and should be on the radar of Maine healthcare providers. Next, 12.7% of non-institutionalized civilians in the U.S. have a disability as of 2019. Now that long COVID is considered to be a disability and that 1 in 13 adults in the U.S. are suffering with it, we must consider how much the need of assistance will increase. We also must consider the effects of a disability on one's likelihood of developing depression, obesity, diabetes, heart disease, and the likeliness of starting to smoke. For those experiencing these factors, it amplifies the importance of providing resources to those experiencing long COVID. Pharmaceutical care is an important aspect in the spectrum of healthcare. There are several business models and service enhancements used by rural pharmacies to increase access to pharmaceuticals. One example is the use of courier services, which bring prescription drugs to the patient or to an outlying location. Rural communities have been implementing the use of telepharmacy, which is an aspect of telehealth that increases access to pharmacy services. This model helps rural pharmacies overcome common challenges, including financial difficulties related to low patient volume and to a limited ability to recruit qualified pharmacists. Telepharmacy models also help rural communities retain, restore, or gain access to timely pharmaceutical services. Additionally, there are payment assistance programs for individuals, such as the State Pharmaceutical Assistance Program, SPAP, which can help pay drug plan premiums and/or other drug costs. Children's Health Insurance Program, called CHIP, is another payment access plan to help provide children with health and prescription insurance at a reduced cost. In the case of our standardized patient, Amanda, long COVID had caused her to take unpaid time off from work and also limited her ability to care for her family due to her debilitating headaches. For patients experiencing a similar situation to Amanda's, they can request help through the Americans with Disabilities Act, known as the ADA. The ADA will assess the individual employee and determine whether their condition substantially limits life activity. If approved, that employee can receive disability through the ADA and be compensated for their time off. The ADA also notes that a person can request workplace accommodations, including restructuring duties at work, modifying the schedule to include time for rest, and modifying the work environment. These accommodations can be requested if the employee meets the ADA's definition of a disability, if they work for a company with 15 or more employees, and if the employee is qualified for their position that they work in, all of which is the case for Amanda. If Amanda ended up not being able to take complete time off from work, or is put on a wait list for Social Security benefits, these workplace accommodations could benefit her. Additionally, if a person is able to document that they caught long COVID from their workplace, they can apply for workers' compensation. It is important for the applicant to document all doctor's visits and have them print out summaries after each appointment. It is also beneficial to apply for Social Security as soon as possible, as patients tend to stay on the wait list for Social Security disability benefits for at least 6 months. During the COVID-19 pandemic, social workers played a major role in awareness and in addressing social injustices placed on powerless groups in our society. The role of social workers includes, but is not limited to, connecting clients with local agencies to help economic hardships surrounding healthcare, providing adequate social support for at-risk populations, creating awareness of how communities are disproportionately impacted by the pandemic, promoting and acquiring access to online platforms for clients such as telehealth, and advocating for the inclusion for the most vulnerable populations. The graph to the right was taken from the CDC. It illustrates the COVID-19 weekly death rate per 100,000 population in the US by county, urban and rural classification type. The yellow line is our focus as it represents rural populations. We can see that around January 13th, 2021, there are weekly deaths of a little over 10 per 100,000, and recently, it shows on September 28th, 2022, there are weekly deaths of around 2 per 100,000. Although we can see a decrease in the values, we can also see that rural communities are the most negatively impacted. For future directions and takeaways for Maine healthcare providers, understand the population you're working with. If you work in Maine and you are equipped with the knowledge that is predominantly rural, you can gear your practice to serve the unique needs of your patients. Continue to educate yourself on local resources. Be knowledgeable of local groups that you can connect your patients to that support their needs. If patients have difficulty driving to get medications, learn which mail-away pharmacies deliver to your area. Also attempt to be educated on changes in legislation, such as modifications to the ADA to encompass long COVID. Knowing what new resources are available to your patients can help break down barriers to access and potentially improve their outcomes. Ask your patients what their primary concerns are and work from there. If your patient is dealing with difficulties at work because their employer has not heard of long COVID, provide education materials about current laws and regulations regarding this condition to give to their work. Allow your patient a space to tell you what their concerns are and start from there. Attempt not to assume what their primary concerns are.
Thank you for that very informative presentation. I see we have some people from the group. There were 2 teams that actually put that together. Do we have any questions from the group for our team members, our presenters? If not, I will always ask a question. How did you feel about having the different professions represented, and how did that work in your interactions with the patient in this particular case? Was it an advantage or disadvantage?
I found it to be an advantage because it allowed each person to go into the next simulation kind of looking at it as like a different avenue instead. You were thinking about things that you might not really think about in the first place if someone hadn't brought that up to your attention to begin with. So like, for instance, for dentistry, I never realized how much dental health had to do with other aspects of, different avenues, like even COVID itself. So being able to see that and then take that into practice as well has been really eye-opening, and being able to look at even social work too, and just trying to build a whole picture for a patient versus just one aspect of what you're studying.
Okay, excellent. I would ask another question, but we've been asked to sort of wrap things up because we need to get to our last presentation. Thank you so much for your presentation. It was really very informative and good. Thank you.
Hello, today we're going to talk about balancing clinical objectives with patient-centered care. My name is Simran Bogle, and I'm a second-year student at the College of Dental Medicine.
I'm Jen Fountain, and I'm a first-year PA student.
I'm Farah Ressam, and I'm a second-year osteopathic medical student.
I'm Astea, and I'm also a second-year osteopathic medical student. We also worked with Emily, a podiatry student, Allison, a medical student, Megan, a nursing student, and Sydney, a social work student.
IPTE is the Interprofessional Team Immersion, a program between UNE and Rosalind Franklin health profession students to collaborate on a case and gain interprofessional experience. For the fall 2022 IPTE experience, the case was a patient experiencing long COVID. So long COVID causes ongoing, variable, and occasionally debilitating symptoms for months to years after COVID. A quarter of the patients are left with long COVID. This affects them not only physically, but mentally and emotionally. And because there's little information exactly how to treat the symptoms, it makes it difficult for providers. Due to these overall effects, physical, mental, and social, providers need to learn how to balance a patient's personal needs as well as their medical needs. Our patient was 39 years old, and her chief complaints were migraines, which was making it hard for her to go to work, and she couldn't care for her children, and she couldn't travel for care due to how far it was and due to the costs.
The influence on patient support system can be anyone. It can be family, friends, partners. We face many challenges that the patient's spouse was interrupting our patient multiple times in a way that could discount her emotion. However, that was unintentional because they were trying to support them. The challenges that we should face, that we should keep in mind that these support system are trying to support our patient, and also they have some type of point of view that the patient themselves may not aware of, that they need or have or they do. Using telehealth was very challenging because we used Zoom as a way to have that meeting, and some of the challenging through Zoom was connectivity, delay in communication, speaking on one another, also lack of in-person contact. Provider may not have a complete physical exam, difficulty reading facial expression, and difficulty making rapport with the person. Overall, team recognized that telehealth is a difficult method of healthcare delivery that take practice, patience, and professionalism.
Balancing clinician goals with patient desires. As a group, we found that it was difficult to balance what the patient wanted with what we as providers feel the patient needed. The patient wanted more homeopathic and natural remedies for her care. So one thing we did was we swapped her medications in order to cover her hypertension history as well as migraines. We also came up with several natural remedies that she could use. Overall, we found that patients are more likely to be compliant if they feel they have a say in their care. It's easier to manage fewer medications and treatments for patients, and patients like to feel in control of their care. And as providers, we found it was important to be adaptable. We also found challenges working as an interprofessional team. One of the challenges we faced was having every provider have a say in the patient's care and balancing the different providers' wants. We also found that one thing we use as an approach was providing care with the best provider for a certain complaint.
IPTE helped us to better understand that providing quality patient care means meeting the patient's needs based on their individual priorities and values rather than our own. The experience also helped us hone our communication skills when interacting with patients and other healthcare professionals in a telehealth setting. It reinforced the importance of learning from our colleagues and allowing the professional with the most experience on a specific complaint to organize and integrate care with the other specialties.
Thank you for that presentation. Are there any questions from non-team members? If not, I will ask one. You did a great job at listing challenges, both of working in teams, but also with telehealth and the situation in general, the healthcare in general. How did you deal with conflict? I mean, how did you resolve sort of the frustration of working in these different situations?
I can speak on that. So actually, we found some challenges having like a Zoom meeting or telehealth visit by difficulty having a team in the same room with the patient that's already frustrated with all of their symptoms, that everything that they are experiencing, that they have no idea what's going on in their life. So with that frustration, we decided that us working as a team, maybe we should choose a same group of people that will go during the visits, so the patient will have a familiar faces that she can recognize. And I think that idea was very helpful because the patient was able to recognize people and build that trust with multiple visits.
So there must have been a lot of discussion behind the scenes about how to handle things.
Yeah, I think to elaborate further on that, I think that one thing our team did really well is we were really good at working together and kind of piecing together what everyone wanted to do. And I think we were fortunate to have a team where we were all really good at listening to each other's wants and needs and incorporating that. And I think that the people that we picked 4 people to consistently be or we picked 2 people to consistently stay in the room and then switched out people as needed. And I think that by doing that, we also paid attention to what the patient needed, and we were good at listening to each other to see who was best to enter the room and help the patient.
Was it helpful in terms of listening to the patient to have other professionals there also listening so that if somebody missed something, you could chime in?
Yeah, I definitely think that that was really helpful. For example, some of the complaints were feet related. So the podiatry student, it was really helpful for her to hop in and be like, hey, by the way. And then also there were things that some of the students, like Allison, she was able to look up stuff quickly and be like, hey, this is a natural remedy that I probably would have never thought of. So that was also really helpful.
So there were some advantages at least, which is great. Last question before we all navigate over to the 4th breakout room, and that is there one thing that you will take with you as sort of like a talisman or whatever for your career to say, okay, I'm working in a team or I'm working in telehealth? What's that one nugget of goldenness?
I can speak on this one. It's just that you don't know everything, and you like, it's good to know when you should like give someone else the power, be like, this is not my specialty, but I know that someone else knows exactly what to do. Like Sydney was like our team leader, but she knew like so much about like resources that some of us might not have known about that our patient could really use. So like it was nice to know like when I could step up and when I needed to take a step back.
So being humble and having appropriate boundaries. Yeah, that is like a hallmark of all of the interactions that you had, both in teamwork and collaboration, and also I think in telehealth too. Okay, fantastic. Great presentation, great teamwork and work in general.